Birdman. Time for another edition of Summit Healthcare's. I'm hanging out here at Angie Fabian's office in Summit Healthcare in the big old building, level 5. With me today, I have a Dr. Richardson. How are you this morning?
Good. It's good to be here.
Even though it's not morning. See, I confused
That's right.
you.
I knew what you meant.
But I do that because we put it up sometimes in the morning. But anyways, let's talk about what it is that you do. You're what is your specialty?
I'm an OBGYN, also known as obstetrician and gynecologist.
Okay. You're all the letters that guys never have to deal with.
That's right.
Okay, cool. So what do you cover exactly? Because as a guy, I don't deal with this. I mean, I hear that term pap smear and it makes me cringe, but
Right.
tell me all about that.
Okay, so like a typical day for me in clinic would include patients coming in for obstetrics. So I have my patients that are pregnant of all ages. That's about half of my patients, and then the other half are GYN patients. Those are my gynecologic patients that come in for various complaints, everything from pelvic pain to bleeding to menopausal symptoms to sometimes they're coming in for pelvic prolapse. They have the bladder prolapsing or something. And so I have a wide spectrum of patients that are coming in for gynecologic.
So basically, you
stuff.
deal with everything female.
Right.
Yeah, all that
in
sort of-
all ages too.
all that plumbing,
Right.
basically.
Right.
Yeah. Okay. So one of the big things you want to talk about is menopause, and you've got a seminar coming up, isn't that correct?
Yes, that's correct. So at the Hampton Inn on March 22nd at 5:30 to 6:30, we have a seminar planned, and the purpose in this is to give the community an opportunity to come and hear a seminar about menopause, because I've noticed that there's so many people that every woman is going to go through menopause at some point, but there's so many women that have many questions about it and just never have a chance to ask anybody unless they set an appointment and come in, just to ask like what is going on with my body. But I think it's a great opportunity for them to just come and learn about menopause and those changes that are associated with that age.
Okay, and this is a free seminar that's available to anybody.
It is free. That's correct.
Okay. The one thing I guess is the big anxiety point or the fear point is hot flashes, right? I mean,
Right.
Everybody sort of that I know of female-wise, it's the questions that start to happen is how can I skip it? How do I not have to deal with
Right.
it? What is a hot flash exactly? I mean, is it actually you get a fever or?
So a hot flash is it's one of the most common symptoms of menopause, and it's what we call a vasomotor symptom. In other words, it's the body's response to lack of estrogen. When a woman is going into menopause, they stop producing estrogen. The ovaries are stopping that production of estrogen. And one of the most common symptoms I could mention is going to be hot flashes, and that's just a vasomotor symptom, a response of low estrogen.
Okay, very interesting. And then is there ways to keep people from having them, or if they're really bad? And I'm assuming everybody's different.
Right, and it depends on the patient. There are various approaches to management of hot flashes. And those can be with medication or with behavior changes. But there's also perimenopause, where patients will have this irregular and abnormal bleeding that occurs just before menopause, and that can also be kind of aggravating for patients as well. And there's a lot of ways to manage that with medication, or sometimes necessary with surgery too.
Okay, back to the seminar specifically. Is this going to be more of just a presentation, or is there going to be opportunity for people to sort of have a Q&A with you?
Oh, that's a great question. So the idea is to primarily have a presentation, but I do want to invite those who are going to be present, the audience, to be able to ask any kind of question they want during the seminar. So I want it to be interactive.
Okay, very good. Anything else that you want anybody to know about what you do or the services offered there?
I think that's about it. I'm just really looking forward to this opportunity and for a chance for me to be able to get out there in the community and talk to patients and talk to anybody in the community. Anybody can come. They don't even need to be a patient or even a prospective patient. Anybody's welcome to come, any age. And we're going to talk about menopause and perimenopause and all the changes associated with that and what we can do about it.
Very cool. Well, very nice to meet you, Dr. Richardson. Appreciate your time today. And that's going to be it for this episode of Summit Healthcare's. I'm Birdman. Remember, you want to check out the playlist that's down the corner. You can subscribe to that, and you can also click on the subscribe button here on the YouTube channel. Check out also the Facebook and Instagram pages for Summit Healthcare. And I'm going to remind you one more time to be healthy.